The umbrellas and the rain jackets handy. Mitchell, appreciate the update there. Keeping an eye on some of our next items coming up. Topeka's Scent organization is putting individual health and addiction recovery alongside community services to make the Highcrest neighborhood a better place for the people who live there. Tricia Ogier-Duvall is a community health advocate at the Southside Wellness Clinic. Welcome to you.
Hey, Melissa.
You have so much going on over at the Southside Wellness Clinic. What is the overall goal that Scent had in launching that clinic?
I think the primary goal was just to fill a need in the East Topeka area, but primarily for Highcrest residents. There's not a lot of accessible clinics and other medical services on that side of town. So we wanted to bring kind of the services that were needed to the people into the Avondale East Care Center and make it where folks can come in and get the care they need and do it in a way that is not creating a barrier.
Well, exactly. How important is that accessibility, especially when you talk about, because one of the things you've made sure is it's not just physical health, it's mental health and wellness, those addiction recovery services. How key is access when it comes to all of those things?
So I think it's a big benefit that we have so many things located in one building. And so whether folks need to come in to access the pantry or speak to someone in our neighbor advocacy area, come into the clinic, get mental health services, substance use counseling, all of that is in one location. And because transportation is such a barrier for members of our community, having us all there in one space just makes things easier for everyone and kind of takes that stress away trying to get from place to place.
That's one thing to say, and when you talk about addiction recovery, the first step is admitting you need help.
Yes.
But if you can't get to that help,
right, or if it takes forever to get to that help. So, you know, the Southside Clinic is directly across the hallway from both our mental health and our substance use counselor. Our neighbor advocates are like 2 doors down, right, in the same building. And so just making ourselves available and even if there is that hesitancy, just being present and socializing with folks as they come in, introducing ourselves, letting them know that we're there if they need us.
And you all have gotten a grant this year to specifically address, is it opioid addiction recovery?
Yes, opioid addiction. We do see some patients for alcohol use disorder as well.
So what are your approaches to those things?
Oh goodness, we use a multitude of approaches. So generally, after meeting with our substance use counselor, a referral is made to the clinic, and we kind of assess a patient's overall health, and then kind of taking a look at what other medications they're on, what history they have, and coming up with a treatment plan that's going to work best for them, depending on the type of treatment they're being referred for. We do a lot of holistic intervention as well, herbal intervention, preparation before treatment begins, just to kind of prepare the body, help them deal with those stressors, deal with some of the emotional and other things that come up when it comes to substance use treatment as well, to help prepare them and their families as they move into that.
It really is kind of a multifaceted thing that happens.
Absolutely, and our team works, you know, really hard to communicate and to make sure we're all on the same page, to make sure we understand, you know, what a person's needs are, what they want and what they don't want.
You have some medication-assisted treatment as well. How does that work?
So depending on the type of disorder and the type of treatment being used, there are medications that can be dispensed by myself and other healthcare workers in the clinic. There are injectable medications, there are pill forms, there are a multitude of things that are available depending on you know, a person's history with addiction and what they know will and will not work with their other you know, medical concerns.
Do those apply to all types of addiction, or I think you had mentioned that there are some medications specific to opioid use disorders?
Yes, generally the medications that we use can be used for both opioid and alcohol use disorder. We do have some patients with methamphetamine or amphetamine-based addictions as well, and we have some options for them too.
Some of that seems kind of counterintuitive, right, though? I mean, you're talking about treating a dependency on a substance, and you're giving them a substance to do that. How does that make it make sense, Tricia?
So a lot of the way they're pharmacologically compounded, everybody is mostly familiar with Narcan, naloxone. A lot of those medications contain that kind of as a buffer in the event that there are, you know, stressors that come up. Cravings come up, things like that, and so the medications are formulated as a preventative as well in case there are incidents of use or anything like that.
And recovery's hard because, as you mentioned,
yeah.
the body does physically go through something. So when you talk about the holistic approach and the herbal remedies, what are those specifically designed to do for a person?
So primarily, we do a lot of adaptogen type therapy, and adaptogens are herbs that kind of help your body process and deal with stress in the way the body does that with the brain and the adrenal glands. And so we try to nourish those areas, diet, appetite, nausea, vomiting, those types of symptoms, insomnia. Those are things that we use herbal intervention for.
Okay. So you don't have to suffer through it. There are things that can help.
And if we know that a patient's going into treatment, getting that started ahead of time is crucial to the outcome.
How can people find you? If they're saying, you know what, I think I'm ready to try something, I need some help, how can they find you?
So they can call, set up an appointment, or just to kind of get some information from our substance use counselor. We are located in the Avondale East Care Center, 455 Golf Park, here in Topeka, and folks are welcome to walk in as well, just to talk to someone and see what we can do to help.
Do you have to live in the High Crest neighborhood?
You do not. Our services are open to all Topekans and anyone kind of adjacent to Topeka. If there's services that you need, you're welcome to come in and see us.
ScentTopeka.com is the website to look at as well. And of course, we do have a lot of resources in addition to that on WIBW.com/hearmeseeme. Tricia, thank you so much for filling us in on the valuable resources you have.
Thanks, Melissa.
Appreciate you.